Hi, Dr. Matt here today. Today, I want to talk about spinal and joint hygiene. And the reason why I want to talk about this is because of the epidemic of osteoarthritis, joint degeneration, and disc degeneration that is just going to new levels today. And so there's really three pieces when it comes to joint hygiene that we want to talk about. But what got me into this and what got me into talking about joint hygiene and spinal hygiene is this epidemic that's going on today when it comes to osteoarthritis and degenerative disc disease and degenerative joint disease. Right now, 96% of adults age 80 have arthritis. So if you walk down the path that so many Americans have today, you're pretty much going to get arthritis, as the outlook isn't looking too great for you. 85% of 50-year-olds are getting it. So you can see it's just a progression. And many people will say, well, arthritis is just an age thing. Well, the reality is it's not, okay? And let's go over a scenario where it's not an age-related thing. And another industry that I like to use is the dentistry. And so if you look at what happened in the early 1900s, dentists just all the time were just pulling teeth left and right. That's what happened when you went to the dentist. You had a rotten tooth, they pulled it, okay? Until a guy by the name of Alfred Phones came along, and he was the father of dental and oral hygiene. And he said, you know, we know that there's this bacteria that creates this acid that decays the teeth. So what if we started to keep the teeth cleaner and take care of them and put some maintenance into them? We probably could prevent this from happening. Well, there was a huge resistance in the beginning. And the reason why is because dentists saw income going away, because what their job was to pull the teeth. And that's how they made a living, is by rotten teeth. Well, it's kind of what's happening today in healthcare. We get to this point where there's arthritis there, and that's where all the money is when arthritis is already there. But it's not good for the patient, okay? And so osteoarthritis is kind of in that same position right now. We know that with dentistry, dentists have done a fantastic job of educating the population to keep their teeth clean, come and get them cleaned every 6 months, and then brush them regularly. And you're going to be able to maintain a healthier tooth and prevent dental decay. Well, when it comes to spinal decay and joint degeneration, the education has failed, okay? And so there's three things that we want to start talking about when it comes to joint hygiene, so we can begin to start this prevention process. What we know today is that osteoarthritis is showing up in children as young as 10 years old. And I'm not okay with that. With our sedentary lifestyles that we have today, with video games, with computers, with iPhones, is getting worse and worse and worse. So there's three things we want to focus on if you want to prevent osteoarthritis from developing in your body. One is to make sure your joints have a full range of motion. And so every day you want to put your joints through full ranges of motion, getting the nutrients in and the waste out of those joints will help to preserve the long-term function of that joint and reduce osteoarthritis. You know, if you think about it, when you were young, you were running around all the time. You were, as kids, how many different positions did you put yourselves in? Climbing on the monkey bars or the swing set or rolling around in the grass, right? And so it had an opportunity for our body to keep those joints healthy with the movement. Well, with society today and sitting and computers and doing the same thing over and over and over again with repetitive tasks, this range of motion has begun to change, okay? And this is the first step to osteoarthritis and spinal decay and degeneration from happening. The next piece is to make sure there's good alignment. And so the only doctors that I know of that do the best job of keeping good alignment are chiropractors. They correct the subluxation complex to make sure all those bones are correctly aligned, keeping the pressure off the nervous system, okay? It's a very critical component of making sure that the spine stays healthy. Let me give you an example of this. So many times we'll have patients come in to us that are in pain, right? And we find that there is subluxation there, as well as arthritis and this whole complex of decay and degeneration that's going on. But what brought them in is not because of the bad alignment. What brought them in is the pain that was associated with that. And so pain is always the last thing to show up, and many times it's the first thing to go away, but the problem isn't always corrected. And so that's a hard concept for people because we've always based our health on how we feel versus how we function. The last thing we want to make sure that we keep healthy is a balance between two types of muscles, our postural and our phasic muscles. And I've created a video on this talking about postural and phasic muscles and how they create trigger points. So spinal hygiene is going to help to prevent and reduce the arthritis from developing in your spine and in your joints, so you can begin to live a longer, healthier life, pain-free and full of healthy function. So be sure to share this video, comment on it below. We'd love to hear what you have to say, and look forward to seeing you on more videos.